welcome to everyone. Thanks for joining. So our plan today, we've got an hour on the clock. We're just going to give a bit of a brief intro just about what we're going to do today, who you're going to be hearing from, what we're going to do, and then throw over to anyone for any questions. So as we go through, please do feel free to throw any questions. There's a Q&A section in the Zoom platform. Please feel free to throw the questions in there. We'll do our best to answer those today. If we don't get to answer them today, we will make sure that we get answers out to the group to those questions. So yeah, please do feel free to ask any questions. Really, the plan for today was really to look at Dossplorer, as most of you know, the ECTD management tool that we have at Celegence. We're going to go through that, a bit of background, and see predominantly some new features that have come around since most of you have been using the platform. So just wanted to talk through those and again, ask for any feedback or questions that you may have. So I guess just starting a little bit about Celegence for those that you don't know. So we've got global presence. We are headquartered in Chicago and then have operational offices in the Netherlands, Romania, and Bangalore in India. And then SMEs sort of scattered around the globe across UK, US, and wider. We really came about looking to increase the efficiency from getting product to patient. And you'll see there are a number of large pharma businesses that we work with. We also work across medical device and in vitro devices and combination products, and really span the regulatory affairs spectrum. And then just a brief bit about myself, and then I'll get on to the main event. We don't want to be hearing from me too long. So Matt Tyrell, I'm the VP of Business Development and Partnerships at Celegence. I'm a pharmacologist by training, and then went into industry, manufacturing and developing products for over 17 years, causing lots of pain in the manufacturing team for my regulatory colleagues. And then joined Celegence about 2 years ago to support the business and look to grow the business and the partnerships. So going over to the main event and Hans. So most of you will probably have heard or met Hans. Hans has over 40 years experience in reg affairs and across the pharmaceutical industry. He was the founder of Q-Dossier, the Celegence company that was acquired back in June of 2022. He's now our Chief Scientific Officer at Celegence, and was, I guess, instrumental in the leader in bringing about Dossplorer, which really came about from our offering of services across the ECTD management and creation, and not being able to find anything off the shelf that would make our teams more efficient. So Hans really drove that with the team to create Dossplorer and really allow us to claim tech-enabled services across our offering. So yeah, with that, I think I'll be quiet and I'll hand over to Hans. He's got a few slides to go through just to set the scene, and then we'll go into a demonstration where you'll see it in action. And like I said, please feel free to ask any questions, and at the end we'll try and address them. And there's also an email address at the end if you've got any questions after or want a more in-depth demo, then we'll be happy to help. So Hans, I'll be quiet and hand over to you.
Okay, thanks Matt for the introductions. I will indeed tell more about Dossplorer. So I think the majority of you are already using Dossplorer, or you are aware of Dossplorer, but we have built some new features in there based on some user feedback that we received, and also based on some other needs that we believe are important. And the first one is the regulatory impact analysis. So normally regulatory impact analysis is something, if you would like to make a change, you say, I would like to remove titanium dioxide from my medicinal products. Where have I registered titanium dioxides in my medicinal products? Then you can do an easy search now in Dossplorer. Normally, it would take you a couple of weeks to figure that out, and also for the confirmation that that is true. Now, with the full power search, you will have instantly the results where titanium dioxide is being used, or where a particular filter has been used, or some other examples. Then instant translations. So instantly we can provide you with a translation of product information. And that can be from any particular language to another language. So that is something that we will show Of course, this is relevant for the product information, but also for module 3, for example, in particular if you have your Brazilian dossiers, which are not in ECTD format yet, but they might be in Portuguese, and also that can be easily translated. Then we have the version comparison. So to compare the latest version with the previous version, also that can be done instantly. Instantly, we can also do a document comparison. So I would like to say, I would like to compare the document that we have registered in the EU with the document that we have registered in the UK, for example. That is something that can be done. And then besides all of that, and you know that we can upload eCTDs, that we can upload the non-eCTD electronic submission, that we can upload any file and folder structure, we would like to emphasize on the fact that with that upload of any file and folder structure, we can also load non-eCTD documents. And think about your company core data sheets. Think about the health authority communication, including, for example, scientific advice meeting minutes, the PIPs or the US counterpart, the PSPs. Any request for information, so the response document that we receive from the health authorities, any approval letters or complete responses. But besides that, also any internal documents. And we have also the ability to upload legacy dossiers. And that is what I would like to show you. And then later on, we will also have some next features that we have planned for Dossplorer that will happen in the near future. So if we have these features here, like the power search, like translations, version comparison, and document comparison, if we upload these documents, then we can apply the same features also on those documents because they are in Dossplorer. So what is that regulatory impact analysis? So we do the power search, and that power search is a dedicated button where we can select, for example, here titanium or titanium dioxide, but we can also apply other Boolean operators. We can also search for information in our data sets, for example, so it also picks up that. We can save those searches. We can also export those searches to the outcome, the hit list. We can export that to Excel, because that's what we can do here with these buttons. We can save them. We can go to the save searches back with that button. And there we have then the export. And you can even think about, hey, if I have an export of last month and I do create an export now, I do a compare of these two exports, and I know exactly what has been added to the entire portfolio in Dossplorer. Then you can search for that. You will get a hit list, and the hit list might look like this. But there, and you can't scroll through that, but we will do that later on real life. And then we have also the filter attributes. And within those filter attributes, we can say, for example, okay, I have hits under the current, the obsolete, documents that are obsolete and not applicable. Not applicable means that that comes from a non-eCTD. That comes, from example, from an IMPD that is uploaded, or that comes from a legacy dossier that is not an eCTD. It can also be that it comes, for example, from some regulatory guidance that you have uploaded or a scientific advice report that you have uploaded. So those are the non-applicables. But if you say, I would like to know only where it is in my current view, you select that, you apply the filters, and it's good. But also what you see immediately is that the titanium dioxide apparently has been used for ibuprofen Celegence, and it has been used for dexamethasone Celegence. So these are the two products that are on the list. And it has been used in the United States, Portugal, the European agency, European Union, and in Croatia, for example. But we can also filter down and say, no, I'm only interested where that titanium dioxide is listed in P1, the description and composition, for example, or where it is listed in my SMPC and labeling information. So those are the other type of filters that you can apply. We will see that in the live demo. Then we will have the instant translations. So that is for most of the languages. I believe that we have 140 languages in here. And as you can see here on the right-hand side, and this is just a brief piece of that, we have Chinese, different types of Chinese, but Croatian, Czech, Danish, Dari, Divei, so any. And the same applies also here on the originals. That will be multiple. And like I said, we can do that for the product information, an example that we have here, where we translated the Portuguese text. So it recognizes the text as Portuguese, and then we can say, okay, translate that for me into English. This is not a notified translation. No, this is not by a notary that it has been certified, but this is absolutely sufficient information to verify, to check, have we already listed that contraindication there or not yet? Or what is the description that they have in their Module 3 documents? Or has it not been described? You know, these kind of things is something that we can easily do. So I will have some examples on that, how we can do that as well. Then we have the instant version comparison. So I take a document where I have multiple versions, and in this case, for example, I took here a document where in this case, it is the SMPC. And there you see that we had an SMPC with 24 months of stability of shelf life, and the latest version submitted in sequence number 4 is 36 months of shelf life. So immediately that pops up. Another comparison is where we say I have here my ibuprofen description for the Celegence liquid capsule. And that is a document that was submitted in sequence 1, or I don't recall exactly based on this example. And we compare that to what we have in our legacy. And then immediately you see that titanium dioxide has been removed from the formulation. And these are the strong features that you can easily find and retrieve that type of information. Then we say we have also the ability to load non-ECTD electronic submissions. And what we have done here, for example, we have the CCDSs, forget about the name here, but there we have the SMPCs at the MHRA, for example. There we have some other SMPCs. You can include also your entire EPAR. So this is just the product information from an EPAR, but you can include the entire EPAR. And also this will be full text available to you, and you can do your searches. So also then these EPARs, these summary basis of approvals, if you upload them, you have them full text available. So think about your scientific advice meeting minutes. Think about your PIPs. Think about the request for information and so on. And also that we can include also some internal reports. And we have our legacy dossier. So what you see here is that we have, and I will show you that later on as well, we have there the ECTD. It says ECTD, but you see that little bell. And that is a symbol that there is something else with that bell. It is an alert that we have here. And what we have here is now that we have a document description and composition that has been submitted to this US health authority, where it is submitted in sequence number 1 as new, but the legacy is also there. We have done a kind of reformat. We have not submitted that to the health authorities, but we keep it on file for ourselves so that we have a thorough understanding of the information that has been submitted to the health authorities, what is, according to the reformat, the current state. And then we can see even the continued life cycle in the ECTD. And there you see that we have also this description and composition, which is then the latest version. And then you can imagine that we can do many more things. The more and more types of documents go in, we have full text search across all the documents. Let me make that clear. There are other tools or vendors that say that they also have full text search. Indeed, that's true. But that is only in a PDF file. So you open the PDF file and then you have full text search available. For us, since all the documents, everything upon import is indexed, all those index are in the database and that will be searched for full text. So we have some other things there, and that is still under development, and that is the new user interface. We also have some tools for IDMP data collection and IDMP updates. And we have, this is also one of the things that was requested, a where used function. Where have we used this particular document? Where have we used this particular text? And also that is something that is under development and that will be delivered. And I'm looking here to my left where we have the product owner. I hope somewhere within this year, this calendar year, that is still on the target list to do that. I would like to go to the demo first, and then we will continue, if time permits, with the other developments. We have also that. So I'll go to the demo. This is our landing page. I'll open that. Normally, you will have also the two-way authentication, but on the demo environment, we don't need that two-way authentication. So the first things that I want to show you, and maybe for those who never have seen this build EC2D viewing tool or the Dossplorer, on the left-hand side, we have our dossiers. And as you can see here, we have EC2Ds for Switzerland, we have EC2Ds for the US, the EU. We also have a volumized PDF where we have, this was the first submission, where we had, for example, volume 2 here, and volume 2 contains of these 83 documents, and that includes the non-clinical overview. So also that is fully navigationable, and the other thing is that it is also full text searchable. We have here an example of the legacy, and I will show you that later. And we have also the ability to upload the IMPD. Now, there it is. So here we have, for example, uploaded the IMPD, and we mimic an EC2D lifecycle there. It's not EC2D, so therefore it's also not a real EC2D with lifecycle, but we can create a current view, a cumulative view based on all the IMPDs that we have submitted. And also here you can see that it is fully navigationable. Then we have also, as an example, as we said, we have our company core data sheets and QA documents, for example. We have our SMPCs from the MHRA that we have uploaded, and here we also have our SMPCs coming from eParse, for example. So because we have this in, you can apply the structure yourself. That is all fully configurable based on the source. So we have a home where the dossiers to be imported has to be located. The folder structure that you use for, let's say, that SFTP site, that shared environment, that folder structure will be interpreted and uploaded as such. So if you build a structure there, that structure will be represented also here in Dossplorer. And we can browse for that. So one way is to go through all of these documents, of course, all of these dossiers, and to find the information. There's also then the power search, what I would like to show you here. And for example, if I say, first, let me remove all the existing filters, because there you see current is applied. So I will remove those filters. And then here, we can search, for example, for the 0.5 micrometer filter. And then I search for that. I instantly get my result, and there is a content match for these documents. Now I see that is on identification and assay. I see here there is another type of document, but like I said, we can now filter here. So in this case, I am only interested in the current ones and where it is not applicable. Then there you see the dossiers that are impacted by that, the product groups that are impacted by that, and also the product names. Now, for example, I'm only interested where we use a 0.5 micrometer filter for the production of paracetamol, and it might be all, in all of those countries or only this. Now, I apply this filter here, and then you see that we are limited to only a few documents where we have that 0.5 micrometer filter. And I can easily go there. Let me take, this is US, yeah, US. Well, in this case, it is all in the first sequence, but we can go here. It ripples down to the document, and that is also, it will show up. And this is already very helpful that we immediately find the information. You can also narrow down that filtering even more, but this is one of the ways that we can do that. Another one, if I apply something else, and that is something what we have saved. So you can save your query. Now here I have the saved queries, and this is something that I did yesterday. And I say, okay, apply that filter. So now you see that the term not Hispanic in combination with Wonder 20, and Wonder 20 is the drug that the patient used, is something that pops up in a SAS dataset. Now I can go for that SAS dataset. Say, okay, show me where is that SAS dataset. This is the SAS dataset, and as you can see, also the SAS datasets are visible. And that is where we have the ethnicity as, so race is other or white, and ethnicity is then not Hispanic. And here we have the one that is on Wonder Drug. So even it is not only in PDFs that we search, but also in the data sets that you can find that information. Now, this is not such a nice one. Let's go back here because there we have some more. And here what I can do now is I can export also this. I give that a title and I say, okay, let's give this here the 0.5 micrometer filter because that was what it is about. Hans testing. I export that. And then here I get my Excel. And within this Excel, I get the details about the documents that were listed. They are coming from this particular dossier, that particular sequence number. This is the path. This is the file name, the leaf title. And if I would like to get to what have I done actually, yes, it was this. I exported that at that particular date. And this is the query. The other thing is also that if I save these kind of export reports, then I can also copy this, Control C, and I can go back to the power search, Control V. I run the search, and in this case, yeah, I get the same information. So I should go maybe first. Oh, now I will search for titanium. Search. I will get my titanium information, Control V, and then search, and instantly I get the results. So it really goes that fast. There I have all my filters. Now, if I do a search, let me do that also for titanium, because I would like to remove titanium dioxide. Titanium dioxide. Oh, the search was already there. Yes, of course. So search. Then I get my hit list. I have to delete all my filters that I applied. Now I get my hit list, and now I can narrow down in the filters. But I can also say, no, I would like to have only where this information is listed in P1 composition, because that is the composition. So give me that. And then for the attributes, I only would like to have that where it is still current, because where it is obsolete and no longer listed, then that's fine, but I have to remove it from my existing registration. So I apply those filters. I instantly get this type of information, and I see that it is listed as sequence 1. Then I go to, let's say, yeah, let's go here. I have sequence 1. This is for the EU. Let's take this one. I go there, and then I have this particular document. So instantly you have that. I should have taken ibuprofen because that is the one that we have uploaded, we have replaced. I'll go here. I know that here I have my quality document, my P1. Oh, I said that it was current. So I have my P1 description and composition. I click on this one. And now I get a warning. It says, hey, you have opened a document that is obsolete. So apparently it has been replaced. So I can say, okay, here. I go here, I have my document. As you can see, this one is obsolete. That is the current one. And the nice thing is now that I can do a compare version. And within that compare version, I have my sequence 0. I also have to take then here sequence 1, of course, otherwise there's no comparison. And then you immediately see where the differences are. And that is that now the sodium is equal to da 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 da, and in the new one it is 20 and it is 40. And how come? Because the titanium dioxide, which was also 110 milligram, has been removed. So the composition is different. And that is something that you can instantly see. And this will save you weeks for a regulatory impact analysis, really weeks. So that is one thing. That is the compare version. But if I go back to the slide deck and then here, where is it? That I said compare documents. I have to check which documents I can compare. But let's take, for example, the ibuprofen for the EU versus the HR, the Croatian NIS. So let me do that. I go to the Croatian NIS. There it is. And better, I go to the current view. I go to, where am I? This is the ibuprofen. Where's Croatia? Oh, Croatian NIS. Wait, I have to go to the cumulative view. Because a NIS does not have a current view. So I go to the cumulative view of the NIS. Yeah, I go there to my P1 composition. And this is where I have my description and composition of the tablet, ibuprofen tablet. Then we have also the metadata associated to that. And that is, for example, we can say the product name, the operation type, we have the sequence number, we have a submission date maybe. So all of that can also be shown. Now I say I would like to have this one, add to compare. I go to my European document that I have, and I say also here, add to compare. I can go to my list over here. I have to select now the documents that I would like to compare, and that is this description and composition. And here it still is that particular document. I do the compare, and there again, apparently in Croatia, we have not updated that information that the titanium dioxide has been removed. So also this is something where I immediately see how come that we have those differences. So that was the compare version. Then we the translations. I have not shown you the translations, so let me show the translations. So going back, close. We have, for example, I believe that is this dossier here, the administrative information. We have the product information, and that product information is in Portuguese. I have my document here. What I can do, I can say translate document. There is my, so it recognizes that it is Portuguese. It thinks that it is Brazilian Portuguese, cannot judge on that. But then we can have the translation to English, and there will be an instant translation to English. You can check that. This is all based on Microsoft Translate. So it is not just one that we got from the corner of the street here. No, this is really Microsoft Translate, and that is very reliable. But we can also go to, for example, Chinese. Let's go to Chinese traditional and then also translate. And here on the fly, we get also the Chinese translation. I have no clue what it means, but at least if you have people in your local affiliates in China, they can also do these kind of things to have, let's say, a first draft of the translation. So it is also that easy. Then the other things that I wanted to show you, going back to the slide deck. That was the, no, we have seen that upload the legacy dossiers. The legacy dossiers is also something that we have done. So going back here, we close this. And go back to the first one. There we have a legacy here for the US. Then what you can do, so this is my ECTD sequence that we have here. This is my ECTD sequence. This is the legacy that we have uploaded. So we have done the legacy, we have cut and paste the documents, for example, we apply the same document granularity with the naming convention and so on. So what we have here is, and let me go then also to the same P1, description and composition. There we have our legacy. I can go there for P1. And I have there these legacy pieces of information. And of course, I can do the comparison, but the nice thing is also that if I go here to current view, that I think I have not selected the document. Otherwise, it would ripple down again to the same document. But now I can go back to P1. And what you see now is that we have then, and I will show you the metadata, that we have the format, the country, the product name, the documents, the operation type, and the sequence number. And within that sequence number, you see that this is legacy. You also get already an alert that this is an italic and has a different, a different color. So that is already showing that even though your legacy might still be in a different system, if you upload this to Dossplorer, then also it will be made available and all those other features will also be made available. So far, are there any questions? Anything that you would like to see, that you would like to check whether that's feasible? Let me know in the chat, or maybe you can unmute. I don't know whether that works.
Yeah, Hans, we've got one question here, so maybe we jump onto that now. So when we extract a spreadsheet after applying a filter in Power Search, can we use that path link to go to file location in Dossplorer?
That's a good one. I'm looking to Costa here also. So let's see. So we have that advanced search. We have the spreadsheet. I don't think so. I think what you have to do. So that should still be here. So there we have this. This path would not help you. But then again, if you take here the summary and from this summary, come on. How come that I cannot? That's weird. I'm clicking on this summary and it does not respond.
Try the enable editing, Hans.
Yeah, it does not respond. Here, also that. Okay, it seems that I have some issues with Microsoft Office. So, close. Let me do it again. I will go to a search one. I'll go for this one. So, apply filters. Then I have my document. In this case, it takes it from the EPAR, as you can see. Now, I would like to export this search. That is West export. I have my document. Hopefully it opens now correctly. Then I have my summary. There is my summary. I can take this one, Control C. Let me close this and if I do blank and search, I get everything that is in the database. Every item in the database is now listed here. But then subsequently, I can Control V, enter. No, not enter, but search. I get my results, and then you can click on that. So that is at least a way to get to the document pretty quickly. Now, this is on current view. That doesn't help. So it should be on cumulative view. So let me go back to where we were here. And there we are, and we have our document.
Great, thanks, Hans. With another question come through. So what other file sources does this support? You mentioned FTP sites or file shares, but for instance, can it show content from OneDrive, SharePoint, Viva Vault, DocuBridge, etc.?
Let's say the SFTP site and file shares. I'm looking here also to Costa. We have done some testing also with Generis Cara, and that worked as well. But the easiest is if it is a file share. But I'm pretty sure that we can use also Documentum environments and also a Viva environment, for example. But that
Yeah,
is something that has been tested in the past, but so far nobody requested that.
great, thanks, Hans.
Yeah?
Yeah, great.
Okay, if there are no other questions, then I'll continue with the slide deck, because we said that we have also things under development. And that is a new user interface, tools for IDMP data collection and IDMP updates, and also a where used function. So the new user interface will be more purple. Let's say the Celegence colors will be more applied than the previous Dossplorer colors. And also things have been improved to get a better performance as well. So that is the landing page. Then also the look and feel is still that we have the tree structure on the left-hand side, the documents in the middle pane, the attributes on the right-hand side, but it is just a different look and feel, but not that much different, primarily the colors that are different. The same also the colors for the power search and also for the comparison. Well, that looks pretty much the same still. The comparisons, whether that is the compare for the versions or the compare of the documents. And then we have this IDMP data collection. So there is a way, and that is one of the admin functions, that we can tell the system what are now the documents that are containing IDMP information, that are the sources of the IDMP information. And I say IDMP, but if you would like to have XEVMPD also, if you would like to have, well, certain manufacturing information, you select only those documents. So this is all configurable, but now it is configured for IDMP data. And then we have said that for the IDMP data, for example, the product information is very important, but also S21 and P31, because those list the manufacturers, for example. So we define what kind of documents are then relevant, and that is what we get here. So the new dossiers that are uploaded, so there apparently we have sequence number 0 of that particular submission. We have sequence number 3 of another submission. And apparently we see that we have some updates in there. And we get this information because that comes from S21. And S is located in a section where we have identified Waalwijk, where we have identified Q substance as the substance ID or the other cities here. So that's coming from that. But also here we have then the documents. So that is also something that you can do. So you can then go to that particular document, do a comparison of what has been changed, and is that indeed the IDMP information? That means that you have to update your IDMP message to the health authorities. That is one of the features that is being worked on at the moment. Another thing is the where used function, and the where used function is about a document. And then we take, for example, a particular document, and in this case, as an example, they use the cover letter, but more relevant would have been a module 3 document, of course, but it's more about the principle. So then there will be a comparison because you know everything is indexed upon import of those documents. Everything is indexed, and you can do a similarity of how with the compare documents, then they will calculate the similarity. And then at a certain time, you can say, I would like to take everything with a particular similarity of higher than, well, in this case, 90% that we have said. And then you can add that to the compare bucket. So similar to what I've shown you. So then that document is added to the compare, and we can do the comparison with the two documents that we would like to include to get clarity on what the difference is. But it can also be that we see that there is 100% similarity. So that means that the documents are identical as far as the content is concerned. So if there are different graphs in there, then a graph is not something that can be compared. But for the text, then the text that is indexed, everything is 100% the same. So that is another feature that we will have before the end of the year.
Right,
And
thanks,
that's
Hans.
the kind of things that we are working on. So we believe that with this, we have built in a significant amount of extra functionality compared to the default Dossplorer environment, because then you cannot do the power search, you cannot have the translations, you cannot have the comparisons. But we believe that on a daily basis, that this is very useful. And we are still ourselves also with the feet in the dirt, because we are also working on regulatory dossiers. We do get change requests, and what we see working for our customers, that actually to have that full text search, to have the ability to compare, would make our lives so much easier, because now we have to open all those documents where we think that the information might be located, and we have to compare them manually, or we have to export the documents and compare them in Adobe Acrobat, for example. And this is why we believe that if we could upgrade all our customers to these latest features, then our services and our consultancy would even be more efficient, because then we are really tech-enabled services and we provide tech-enabled consultancy. So with
Right,
that, I would
thanks.
like to close here and open up for other questions.
Yeah, there were two other questions that came through. One came through just as you had an IDMP, so the person had asked about seeing what Dossplorer can do for IDMP. So I think you've covered that one.
Yeah.
Another one has come through just on publishing and submissions, and saying, could you just briefly explain how Dossplorer helps the efficiency of the P&S process?
The publishing and submission. That's a very good question, because now we have at least we can identify the documents that are impacted. And that means that all the customers, all the companies, I'm pretty sure that they work with some kind of outline of a regulatory dossier. And that outline, that could be in Excel, could be in other tools, maybe PowerPoint, not PowerPoint, Microsoft Project. But anyhow, some kind of outline. And this helps you to identify those documents that should be in the outline, because those documents have to be updated. Of course, then an additional application form and a cover letter has to be associated to that. If there is an additional manufacturer or change in manufacturer, then in the EU, you have to provide also this, the GMP certificate. But I'm pretty sure that also in the GMP certificate, that company, that manufacturing site will pop up if that has to be replaced. So that is where it helps. These are some other features that are also in our backlog in the development. So what we have listed is, can we create an export of those documents imported or impacted, those documents impacted, because that could become an outline in either Excel or in PowerPoint. So this is on the horizon. We know that this would be a very nice feature. And then ultimately, yes, can we create the next EC2D sequence if we can just tag the documents that we would like to replace or that we would like to add? Well, this is not what we are aiming for at the moment, but if there is a real business need, then we would like to do that, but we do not like to invest a lot of money in something to compete with the existing EC2D builders, while we are primarily complementary to what they do, or complementary to the RIM database, or complementary to the document management systems.
Right, thank you, Hans. Okay, so I think that's all of the questions we've been through. Just give a few seconds if anyone's got any additional questions, either throw them in the Q&A area, or feel free to raise your hand, and we can aim to unmute you and
I can show a little bit more. In the meantime, I can show a little bit more maybe about the IDMP feature, because this is our test and demo environment. So I know that we have this already here, and I feel comfortable enough to show that. So if I go here, we have now, since I checked in for since I checked for the latest time, we have some new dexamethasone information. So I go to the dexamethasone, and what I see, there are new documents included, and that is, we have highlighted that inform me about any new documents on specifications on the excipients. Inform me about any new documents on the manufacturers, for example. Inform me about any new documents on container closure, and there are more that are configured as such. And then you see that there are new updates on these documents. And then, of course, I can say, okay, I would like to do the compare. I add that, and I can do the comparison. But also what you can do here is that you have a kind of validation status. So now I know that I have to process this for IDMP. And by default, everything is here in this stage as a new file. But then I can say also, no, this here is in progress. I have gone through this. Indeed, there is an update necessary to the IDMP message. And once the IDMP message is sent out, then I can say, yes, now I validate this. So this has been informed. That is, we are compliant with IDMP. And that is how we can process that type of information. And then at a certain time, you will see, yes, for this dossier, everything turned into green, for example. So that is about the status, and this is how you can use that.
Great, thanks, Hans.
Yeah.
All right. Well, yeah, looks like we've come to a natural end. I think there's been no other questions posted. I guess to the audience, just a big thanks again for attending. I hope you found today useful. Feel free to reach out to us with any questions or queries that you may have. You all should have had my email through the invite request. So yeah, please feel free to reach out at any point.
And also, if you believe that you are representing at this moment maybe regulatory operations on this call, and you might think that this would be very helpful for your labeling department, would be very helpful for your CMC department, or even for production and supply chain. The pharmaceutical development, for example, they all should benefit from this. If those people are not on the call, we are happy to redo this demo and inform them about the features, because it is not about the data that we gather, it is about the information that we obtain from that, the knowledge that we gain from that, and how easy we can take the decisions that make a change to the pharmaceutical industry.
Great. Thanks, Hans. That's been great. Appreciate your time as well. So yeah, with that, we'll close the webinar. But yeah, thanks again for everyone for attending, and we'll share the recording and the questions in the coming days. So with that, thanks everyone, and speak soon. Thank you.
Have a nice day. Bye-bye.
Bye-bye.